Well, I'm wishing you a good day as we welcome you to considering whether you'd like to take up some of these SLD training courses that we're going to talk about in the next few minutes. A little bit about myself, first of all. My name's Nat Wright, and I've been working with drug users for almost 30 years. I started in 1996 supporting homeless people by providing opioid substitution treatment for them and also wraparound psychosocial interventions. Since then, I can safely say that I've learned something every day I've worked with drug users. They're a fascinating group to work with. And the interesting thing is that compared to when I started almost 30 years ago, there's significant changes in the way we now offer drug treatment, which is a big reason for these courses. So I'm here to really recommend this course material to you and all these courses, and hope that we see you on one of our courses very shortly. This very brief video is a taster as to what you can expect if you do take up one of our newly devised courses here at SLD Training. We've really done a change because we've all just emerging from a pandemic, and the pandemic has had a significant impact upon both patients' experience and how we've delivered drug treatment during that time. As we emerge from the pandemic, the Dame Carol Black review has just been published in two parts with strong recommendations around increased fund configuration of service provision for drug users. And so clearly there's now a need, with all this new evidence and changes in policy and practice, to upskill our teams with the latest learning in accordance with their bespoke roles. So we're offering bespoke training according to your needs. We're going to look in the changing drug trends module at such trends, and particularly changes in use by young people as they look to acquire drugs through the internet, perhaps, rather than face-to-face at the end of street corners, as has traditionally been the case. What about the impact of the COVID-19 upon drug supply and also drug treatment? We'll be considering this in this course, and also the internet and darknet drug markets. And finally, we'll take a real deep look at Dame Carol Black's independent review of drugs and what her recommendations were. If you were to take up the drug-related death module, we would again be looking at trends in drug-related deaths and what are the key treatment options available to reduce such deaths, including, but not limited to, take-home naloxone. If you were to look at the new psychoactive substance module, then we would spend time looking at definitions, different types of drugs, of which there is now a significant number. What's the scale of the problem? What are the risks associated with such drugs? And what is appropriate management? Moving on to new product development, we've seen two new products coming to market in the last few years. One is buprenorphine depot and one is buprenorphine implant. And we would look at those, both product overview, evidence base, treatment initiation and treatment discontinuation. If you were to do the trauma-informed care module, we would look at how there's been an increased understanding over the last few years in the significant trauma that many drug users experience that often leads them into taking drugs. So it's a causal or a contributory factor to them becoming dependent upon illicit drugs. Therefore, we would start with the overview of the National Commissioning Quality Standards and look at those and how they apply to quality care for drug users. We'd then move on to what types of trauma drug users experience and what are the principles of trauma-informed care provision. And then finally, we would consider contingency management and how such can be used to reduce the negative harms experienced by drug users. Spotting overdose signs is a course that has been developed specifically for both clinicians and non-clinicians. We're going to look at which are the key drugs that can cause overdose, how do you spot vulnerability and early warning signs of overdose, and how to respond as a non-clinician and when to escalate to clinicians. And also, if you are a clinician, what should you do in such a circumstance? The management of pain and prescription medication abuse is a rapidly growing field. Over the last 5 years or so, we've had a wealth of new data showing the extent of the problem, and we're going to look at such data in this course. We will then move on to key treatment principles and how can we effectively manage comorbid pain and opioid dependence. Moving on to drugs and physical health, we're going to consider the challenge of multiple morbidity. We're going to look at prevalence, risk factors, and exciting treatment advances in the management of the key following conditions: deep vein thrombosis, and then the bloodborne viruses that are very prevalent amongst drug using populations. That's namely hepatitis B, hepatitis C, and HIV. And then if you were to do the module on gambling related harms, we're going to look at what such gambling related harms are. What are the prevalence and the rapid increase in prevalence over the last few years? What are the risk factors for becoming dependent upon gambling? And most importantly, what are effective treatment options for gambling related harms? And then finally, there's been an explosion in our understanding of the potential problems caused by the internet and also online gaming that people access through the internet. So this module will look at a description of such, prevalence and risk factors for these conditions, and effective treatment options. I hope you found this brief video informative, and it's finally worth saying that you can pick and mix from any of the modules according to the needs of either you as an individual or of your service. So we hope that you found this really informative, really interested, and we'd be excited to welcome you on one or more of our courses in the not too distant future.